Hey everyone, Dr. Kevin here over at HealthFit.
This is Dr. Daphne.
And today we want to talk a little bit about just what happens after you've had maybe like some sort of ankle sprain, or maybe you've been sitting for a while. What does that do to kind of like your lower body and its movement? A little bit about what we call movement patterns. And it sounds more complicated than it probably is, but in short, your body has probably developed certain ways in which it has learned to move. And sometimes that's very efficient, but it's not always effective.
Right. So, Dr. Kevin, recently we've had a lot of patients come in with a ton of knee pain and ankle pain that's been happening over and over again. Would you be able to touch on why that is?
Yeah, so sometimes what happens is, or usually what happens is when you have a sprain, you cause an injury to a ligament, and so when that happens, it changes the way your body wants to move because your body's natural instinct is to guard.
Right.
And so in the process of guarding and allowing your body to recover, your body starts to learn how to move efficiently, but not always effectively.
Gotcha.
Does that make sense?
Yeah, so what you're saying is that our body learns how to move in these patterns that might not always be the best for us, right?
And one of the most common things we see is people talking about like this chronic knee or ankle pain or lower body pain. And a lot of times what you see is maybe like when you're walking up or down stairs, you may notice sometimes you feel like your knee kind of collapses a little bit, or maybe you just you feel like you're using your thighs a lot and you're not able to use your butt. Well, that is perhaps something that your body has learned how to do.
Being efficient isn't always correct, right? And
Yeah,
then everything, or at least how our body has learned how to move, hasn't been the best way to move. Over time, we kind of use different muscles that are not supposed to be used, and eventually that causes things like long-term knee pain or long-term ankle pain.
Or maybe you're using something a little bit too much, and so because you're using something a little bit too much, that can lead to some of the discomfort that you have as well. So someone who's perhaps had like a chronic ankle sprain, they may be more fearful of trying to apply weight into their foot the same way as they would the other side. And so because of that, they're going to perhaps use more muscles that are like further up what we call up the kinetic chain, or maybe they're just not activating certain ones enough down at the bottom, and then that changes the way that they move, leading to possibly like areas of pain and discomfort.
A lot of us sit for a long time for work, right? How would that affect what happens down our kinetic chain?
Right, so well, if we sit for long periods of time, certain areas of our hips can get tighter, or areas can get kind of stretched out, and then that doesn't allow our muscles to engage the way that they need to. When you get up to move after a while, your body's just kind of learning, okay, well, how do I move efficiently, but it's not, again, moving as effectively as it needs to, using all the muscles that you should be using. So one of the common things we see for people talking about knee pain is actually, we see this kind of compensation or this efficient movement pattern perhaps, but not necessarily the most effective. So Dr. Daphne's going to go ahead and go down, and you see her knees kind of go in a little bit, and then she comes back up and exhibits a similar type of movement pattern. And one of the things that may be contributing to this is the fact that maybe her hips are not that strong. More specifically, kind of when we refer to hips, we talk about like the butt region. And the butt's really important for helping you to stabilize your knees as you go up and down. So when you're able to engage them better and more effectively, that allows you to not have that kind of knock knee position as you go up and down, and that can help to reduce some of that inner knee pain that a lot of people talk about having when they squat up and down in the seat.
Gotcha. And so how do we know what is going on down our leg? How do we know what muscles that are working, what muscles aren't? Where do we even start with that?
Well, I would say first and foremost, the important thing is actually coming in and getting an assessment, because while you might see a lot of things on YouTube to be like, oh, well, you want to fix this particular issue, you want to feel better in this particular area, in order to have someone actually look at what is being used too much or too little, is to come in and get an assessment.
Right. And so it's kind of like there's no one size fits all solution to that, right?
Yeah.
So you can do a few exercises that might work for somebody else, but might not work for someone in a different situation. So for us to be able to get a better idea of what you're doing and how you're moving, we have to take a look at what's in front of us. And from there, we can kind of get a plan to figure out what's best for you.
Yeah. So if you have any questions or comments, or are interested in trying to figure out what that looks like for you, feel free to contact us over at HealthFit. Have a good day.
Thanks, guys.